Hi, my name is Simdile and I'll be presenting the 8 to 2 assessment from the Sentinel U case with the patient Ivy Jackson. I'm here with the patient and we'll begin the interview. Hi, my name is Simdile and I'll be your nurse for today. Can you please tell me your name and your date of birth?
My name is Ivy Jackson, and my date of birth is January 1st, 1963.
Okay, thank you. What brings you in here today?
I'm tired and I just don't want to do anything.
When did your symptoms start?
Well, my husband of 38 years told me a couple months ago that he wanted to have a divorce and that he had a girlfriend for the last couple of years. He blamed me for it. He says I'm not fun to be around anymore because in the last few years I don't want to do the stuff that we used to do.
Oh, I'm so sorry to hear that. Does he still live at home?
No, he left 3 weeks ago, and since then I just can't stop crying. I feel like life's over for me, and I wake up all the times of the night scared, crying, scared, sometimes shaking.
Have you felt like this before?
When I was around 40 years old, I felt less energetic and would have crying episodes. It didn't last long, and I was able to get out of it and move on. However, about 6 years ago, after my youngest son left home and went to college, I just felt very sad and unmotivated. Didn't want to do much of anything.
Have you spoken with anyone about how you're currently feeling?
I have. A few months ago, I went to see a therapist for a few sessions, and she referred me to a psychiatrist who prescribed venlafaxine for me.
Are you still taking the medication?
No, I stopped recently because I felt good, but it was so hard to get off of it. I felt like I had a buzzing in my head.
Have you ever attempted suicide or had suicidal or homicidal thoughts, plans, or intent? Do you have thoughts of hurting yourself or others?
No, I go to church every Sunday. They help me. I also have a great, supportive, extended family. And I have 3 children, Everett, 30, Josiah, 25, and Nia, who's 19.
So how are you feeling the last few weeks?
Well, I've been feeling very sad and unmotivated. I don't want to do anything other than stay in bed all day. I want to sleep, but I can't. I wake up with anxiety in the middle of the night and worry about my future. I've been crying. I lost 10 pounds in the last few weeks. I just don't have the appetite that I used to have either.
Oh, I'm so sorry to hear that. Do you work?
No, I retired last year from the post office after 35 years.
What medical history do you have?
Hypertension.
Do you have any surgical history?
I had a hysterectomy in 2015.
Do you take any medications, both prescribed and over the counter?
Lisinopril 20 milligrams and hydrochlorothiazide 25 milligrams every morning.
Do you use any holistic medical practices such as essential oils or acupuncture?
Nia has gotten me into yoga and meditation and has asked me to come to class with her, but I'm too old for all that.
Do you have any family history of medical or psychiatric problems?
My mother died at 73. She had depression and high blood pressure, which gave her a stroke. My father died when he was 85. He had high blood pressure too. Both my older sister and younger brother have high blood pressure. My sister also has diabetes, and my brother has depression. Let's see. My oldest brother had some really sad times when he was in college, but he seems to be doing better now. My other 2 are in good health.
Tell me about your parents and siblings and your relationship with them.
My parents were married until mom died. They both worked very hard. They really loved me and my siblings. We were a very close family, and we still get together every weekend for Sunday dinner.
Any history of abuse or trauma?
No.
Who do you live with?
Alone since my husband left.
Do you exercise? Do you have hobbies?
I used to walk around the block. Nothing in the last few weeks. No hobbies either.
Any history of arrest or convictions or any other legal issues?
No.
Do you smoke or use alcohol or any illicit drugs?
No, I've never smoked or done drugs. I do enjoy a good glass of wine. Charles, my husband, used to take me on wine tasting adventures.
How are your sleep and appetite?
poor sleep and poor appetite. I've lost 10 pounds in the last few weeks.
I'm so sorry to hear that. So right now I'll go ahead and do a head-to-toe assessment on you.
Okay.
Is that okay?
Yes.
Okay, so I'm going to provide privacy. I'm going to perform my hand hygiene and I'm going to put on my hand gloves. So I'm going to start from your head. Is it okay if I touch your head?
Yes.
Okay. So your head is symmetrical. There's no lice in your head. Then I'll go ahead and check your eyes. I'm going to grab my pen light. Can you please take off your glasses? Okay, so I'm going to just look straight ahead. Okay. Okay, so your eyes are equal and reactive to light. So I'm going to can you follow this pen with your eyes? Okay, so I'm going to go ahead and check your nose to see. Okay, the nose is in the middle and symmetrical and there's no drainage noted. I'm also going to check your ears. Okay, there's no drainage. Check the other ears. No drainage. I'm now going to check your mouth. Can you open your mouth and do Okay, there's no concern noted. All teeth are present. Okay, thank you. So now I would go ahead and check your carotid artery. I'm going to check one at a time. Okay, there's no mass. And there's no swelling. Okay, that's good. So right now I would go ahead and listen to your lung sounds with my stethoscope. Okay, I'm going to stop here. Can you breathe while I do this? Breathe. Can you take a deep breath for me? Another deep breath. Another deep breath. Deep breath. Okay, thank you. So now I'm going to listen to your out sounds. So this is the aortic, the pulmonic, the herbs, the tricuspid, and the mitral valve. No abnormal findings. S1, S2 present. Now I'm going to go ahead and listen to your bowel sounds. I'm going to start from the lower quadrant. All bowel sounds present. So I'm going to check your fingers to see. So less than 3 seconds. This is good. So I'm going to go ahead and check your legs to see if there's any edema. You can put your legs down. Okay. No edema noted. Okay. Everything seems okay. So I'm going to take off my gloves. Okay. So Ms. Ivy Jackson, after the clinical assessment and the blood work done, you've been diagnosed with major depressive disorder. Major depressive disorder is a common and serious mental health condition characterized by persistent feelings of sadness and loss of interest or pleasure in activities. You have been prescribed a medication to help with a major depressive disorder, and it's called escitalopram. Escitalopram is an SSRI. SSRI means selective serotonin reuptake inhibitor, and it helps by increasing the level of serotonin, a neurotransmitter that helps regulate mood in the brain. Side effects of escitalopram are dizziness, headache, increased sweating, nausea, dry mouth, diarrhea, or constipation. Taking the medication with food can help with nausea. You have also been referred to individual therapy to help with your depression. Do you have any questions for me?
No, nothing comes to mind.
Okay. Thank you so much, Ms. Ivy Jackson. And this concludes the end of my Head to Toe assessment for Ms. Jackson.